Today let us analyze the movements of the joints of the lower limb, that is the hip joint, the knee joint, ankle joint and the subtalar joint under some common games which we do. Now look at the focus on the hip joint. So that's a right hip joint. Right hip joint is in extension. And look at the left hip joint. Left hip joint is under flexion. Now here he is trying to kick the ball. Now let's look at the first right hip joint. The right hip joint is towards the midline. Okay. So when it says towards the midline, we can call it is adduction, AD adduction. And the left hip joint is away from the midline, away from the ball. Correct. The ball is in the midline. So the left hip joint is away from the midline. So we can say the hip joint is abducted, AB abducted. Now also he's turning the, look at his foot, his hip is also abducted and external rotated for the kick. So we can call the lateral rotators of the hip is also active here. Now focus on the knee joint here. That's the same picture, but here the knee is flexed and the right knee is flexed and the left knee is extended. Now this picture is a combination picture where we can make out the hip as well as the knee joint and the ankle joint. So here in this foot, in this limb, the hip is extended, the knee is extended and the ankle is in a plantar flexion. That is the plantar aspect of the sole is flexed. And in this limb, you can see the hip is flexed, knee is flexed, and the ankle is dorsiflexed. So this is a common kick which you do in football. See, when you have to first plantar flex, then dorsiflex to complete this kick. You can compare these two pictures. First, you have to plantar flex, then dorsiflex to complete the kick. Similarly, the inversion and diversion. Imagine there's a ball here. If you can keep a football ball here, we can very well make out the so if you have a ball here, this is inversion and this kick is eversion. Okay, imagine it's like a football. So these are the two movements which is used in football. Thank you.